So really, I'm recommending that any patient or athlete that injures their ACL follow world's best practice, which is to undergo an intense, structured, supervised, scientific exercise program for at least 3 months, and it should normally be guided by an experienced and trained rehab professional, so a specialist physiotherapist or someone that's highly trained or familiar with this research. And from there, it's all about signs and symptoms, and if the player is coping well, then we would continue to build them up, and they can always decide upon having an operation at a later date. But the best studies are showing that if you opt for this approach, it's going to give you a superior outcome even if you do have surgery long term. So it really makes logical sense that you would just wait and assess what the outcome is following what we would do with any other soft tissue injury. Yeah, so the first point is that there's a good number of studies now that are showing if left, the ACL can actually heal, and with complete full thickness tears can reunite, which we didn't know, or the assumption was because of a poorer blood supply that it was impossible. But we're realizing that's probably occurring more than we previously thought. So that's the first thing. And certainly if it doesn't reunite, it often can become almost a redundant ligament through intense strengthening at the knee, through balance and through proprioceptive exercises. All this information really has positive ramifications for the general population and for society in general. And I think it's great that we have this information presented to us now. Following best practice is incredibly positive and powerful, and absolutely like a cultural shift is necessary. But it's a bigger issue maybe than a lot of people might realize. So first of all, we need, when a patient or an athlete tears their ACL, we need them to get the understanding that the first thing in their mind should be, I need to commit to rehabilitation. And then if we do that first, then already the game has changed. I think if following from that, we need not only the patients and the general public to be aware, we need all clinicians, so that would be rehabilitation specialists, physiotherapists, sports scientists, sports doctors, surgeons, psychologists, all people involved in the management of someone who has this injury need to be aware of what the lack of evidence that's available at the moment, and also the quality of the evidence. And really there isn't any high quality research to continue a homogeneous approach to every single patient. And so that's pretty powerful. But also we need policymakers to be aware of this information, and they need to create new pathways, so funding for physiotherapy and exercise as treatment for this injury first, and patients should be able to access this before they consider anything that's more invasive. Significant changes from research to clinical practice can actually take normally about 20 years. So we need to fast track this now and get this information into the hands of consumers, the general public, and the media as well is really important. So there's typically this hysteria associated with an athlete that's torn their ACL, but if we sit down and assess the data and the information, the evidence that we have, it doesn't seem quite as catastrophic if we can start rehabilitation and see how the athlete performs, knowing that they're going to have a good outcome either way. So yeah, look, a reconstruction would be 9 to 12 months typically, and that is because you've got a graft that's been put within your knee that has to take into the bony tunnels that have been drilled into the knee. And so from that, you need then to strengthen up the knee and build the athlete back into competitive sport. So without having the operation initially, and the athlete is coping well, it's obviously going to be quicker. You don't really have that trauma from the surgery. You have the ability to get your pain and swelling down straight away and get strengthened sooner, and your balance back, and then your ability to get back onto the park really is often fast-tracked because you know your motor patterns, you know how to move, and then it's just a case of psychologically, are you ready? And then if the knee's coping well, then the athletes will be good to go. with elite athletes, it's potentially even quicker. So the quickest that I've read is actually 2 weeks with an elite rugby player following a full thickness tear, and his musculature was strong enough to cope at the elite level. There's a peer-reviewed journal that's shown an English Premier League player return in 8 weeks. Now, I should hurry to say that we don't want to rush the rehabilitation. It's not really about that. We want to take our time. But the athletes are so strong already, and they're in the frame of mind and conditioned to get going straight away. So it makes logical sense, I think. And the other good thing is athletes are motivated because it's their own body and it's their livelihood. So they really want to get back into activity as soon as possible. So they're quite driven. So there's good potential for them to have quite quick responses, actually.